Indications for extraction. Deeply carious tooth with pulpal pathology, either acute or chronic pulpitis, where a successful endodontic therapy is not possible or patient is unwilling. Teeth with apical pathology. A tooth with apical pathology should be extracted if it fails to respond to conservative treatment. Such teeth are extracted before they involve the adjacent teeth. Periodontitis. Periodontally compromised teeth which are not salvageable by periodontal therapy and teeth with guarded prognosis. Malpositioned and over-erupted teeth. It should be extracted if they disturb the occlusal harmony. Impacted. If the impacted tooth is found to be responsible for facial pain, periodontal disturbance of the adjacent tooth, TMJ problems, or bony pathology like cyst. Retained deciduous teeth. If the primary tooth is retained beyond its chronological age of shedding, it should be extracted to prevent the malocclusion of the permanent dentition. Tooth in the line of fracture. Teeth which are in the line of fracture should be extracted if there is a potential source of infection, dental caries, or fractured teeth. Their retention interferes with the reduction of the fractured segments. Teeth with fractured root. Teeth with a vertical fracture extending into the root of the tooth cannot be treated conservatively. Orthodontic purpose. For the purpose of the orthodontic treatment, certain permanent molars or premolars are extracted. Serial extraction is also one of the entities wherein judicious extraction of certain deciduous teeth is done to provide enough space for the proper eruption of permanent teeth. Prosthetic purpose. Extraction of one or two teeth is justified if it aids in better design or stability. Before radiation therapy, patients who have to undergo radiation therapy for the malignant tumor should undergo extraction of those teeth, which have poor prognosis and are prone to get infected. This is done to prevent the incidence of osteoradionecrosis. Prophylactic extraction. This procedure is done after a thorough medical examination in patients with persistent low-grade fever or with certain forms of arthritis and iritis. It is also done as a pre-surgical prophylaxis for patients who have a higher risk of bacterial endocarditis or rheumatic fever. It may require the removal of all non-vital teeth as well as those of questionable vitality in an effort to eradicate all foci and potential foci of infection. Richards in 1932 showed bacteremia in patients after infected tooth extraction. Ockel and Elliott 1935 showed in a study that Streptococcus viridans was present in the bloodstream in 75% of the patients after extraction. The use of local anesthetic solution due to the presence of a vasoconstrictor has shown a decrease in the rate of spread of infection. Root fragments. Fragments of root should be removed as soon as they are found. However, small pieces of root may be left as such in the socket as long as it does not cause any problem. But with advancing age, it is always risky to leave the fragments, hence should be removed. In edentulous patients, fractured segments present under the mucosa constantly get irritated from the overlying denture, resulting in chronic ulcers, which may sometimes undergo neoplastic changes. The root fragment may themselves undergo cystic or other pathological changes.